It only takes a minute. You walk into the exam room. The nurse slips a cuff around your arm, pumps it up, and reads the results. It seems important, but what exactly is going on? It's a routine check for high blood pressure, also called hypertension, one of the major causes of heart disease. Minnesota's SagePlus program was created to help you reduce your heart disease risk so you can stay healthy. And keeping an eye on your blood pressure is an important part of the story. Hypertension occurs when the force of the blood pushing against your blood vessel walls is so high that it causes damage. Over time, high blood pressure can harm your blood vessels and your whole body. It can lead to serious difficulties, including heart attack, stroke, vision problems, and kidney failure. Your heart is a pump. Your blood pressure shows how hard it's working to supply your body with blood and oxygen. Blood pressure is recorded as a fraction, such as 120/80. The top number is the systolic pressure, the pressure in your arteries when your heart beats. The bottom number is the diastolic pressure, a measurement of pressure when your heart relaxes between beats. You can tell from looking at your numbers whether you should be concerned. Normal blood pressure is any reading less than 120/80. If your numbers are higher than 120/80, it's important you pay attention and talk to your medical provider. Higher blood pressure can lead to serious health problems. So what causes hypertension? Often family history. The genes you inherit from your parents play a role. Hypertension risk also rises for women who are overweight, who take birth control pills, or are pregnant, or who have reached menopause. There are other causes too, like smoking, not exercising, eating too much fat and salt, drinking too much alcohol, more than one drink a day, suffering from stress. Hypertension is tied very closely to where we live, learn, work, and worship. Factors such as safe housing, transportation, education, income, access to healthy and affordable foods, and whether you experience racism or violence all contribute to your hypertension risk. These factors are known as social determinants of health. Unfortunately, they are very difficult or impossible to control as individuals. So, for example, if you do not have access to affordable fruits and vegetables, or it is really difficult to get to a health appointment because of your job or no transportation, your risk for hypertension could be higher than if those things were easily accessible. So, who is most impacted by hypertension? Some racial and ethnic groups are impacted differently by hypertension and heart disease. Communities of color, American Indians, and other marginalized communities are affected by structural racism, historical trauma, bias, and other barriers that may make it harder to access care and resources that support health. This means that people in these communities may be at greater risk of developing hypertension and related health issues. In the United States, 59% of Black adults have hypertension, more than any other racial and ethnic group. Black women are twice as likely as white women to develop chronic hypertension during pregnancy. Black adults are more likely to have organ damage caused by hypertension, potentially leading to end-stage kidney disease,
and are also more likely to die from hypertension and related diseases. Because hypertension and heart disease show up more in communities impacted by structural racism, historical trauma, and bias, they are examples of health inequities. SAGE is dedicated to connecting communities that experience health inequities to high-quality healthcare services. So, are there steps you can take to prevent high blood pressure or hypertension?
Change is difficult and it takes a lot of work. But there's a lot you can do to reduce your hypertension risk, step by step. Quit smoking. It's a challenge, so get help. Get moving. Try to exercise at least 150 minutes per week. Taking a 10 or 20-minute walk is a good way to get started. Watch what you eat. Limit your intake of calories and of salt, saturated fats, cholesterol, and alcohol. Learn your blood pressure numbers and take medication if you need it. Learn to de-stress. Connect with friends. Take time to relax. Try a meditation app or take a few deep breaths. So much you can do. But where do you start? SagePlus can help. It's a smart, free program designed specially for women who want to reduce their hypertension risk. The program's healthy behavior support services can guide you all along the way. You can partner with SagePlus team members for support in taking the steps to better heart health, from learning to take your own blood pressure at home and taking your medication properly to setting goals and making the lifestyle changes that will help you thrive. The journey to better heart health may start with a blood pressure check, but it doesn't end there. SagePlus health coaches and staff at your clinic are here to help you all along the way. To get started, all you have to do is ask.